Welcome to today's lesson on ultrasound-guided biopsy and aspiration techniques. In this session, we will explore the principles, procedures, and clinical applications of these minimally invasive diagnostic procedures. Ultrasound imaging has revolutionized the field of radiology by providing real-time visualization of anatomical structures and guiding the precise placement of needles for biopsies and aspirations. Performing a biopsy involves obtaining a tissue sample from a suspicious area for histopathological analysis. Ultrasound guidance enhances accuracy and minimizes complications by providing real-time imaging during the procedure. During an ultrasound-guided biopsy, a radiologist uses a high-frequency transducer to visualize the target tissue and surrounding structures. Local anesthesia is administered to ensure patient comfort. The radiologist then uses a biopsy needle under continuous ultrasound guidance to accurately target and access the lesion. The needle is carefully advanced into the target area under direct visualization, ensuring that the tip is precisely within the target lesion. Multiple samples are usually obtained using a coaxial technique, ensuring adequate tissue for pathological examination. Ultrasound-guided biopsies are commonly performed for various indications, including the evaluation of suspicious breast lesions, liver masses, lymph nodes, and thyroid nodules, among others. The real-time imaging provided by ultrasound enables accurate targeting of lesions that may not be confidently visualized using other imaging modalities. This technique has significantly improved diagnostic accuracy and reduced the need for surgical biopsy in many cases. In breast imaging, ultrasound-guided core needle biopsy has become a standard procedure for suspicious lesions, especially those identified on mammography or ultrasound. The procedure involves the use of a core biopsy needle, usually 14 to 18 gauge, to obtain tissue samples from the identified abnormality under real-time ultrasound imaging. The samples are then sent to the pathology department for evaluation, aiding in the diagnosis of benign or malignant conditions. The liver is another organ where ultrasound-guided biopsy plays an essential role in the diagnostic workup of focal liver lesions. In patients with suspected liver malignancy, an ultrasound-guided biopsy can provide valuable information to guide treatment decisions. The procedure involves accessing the liver lesion using a biopsy needle, guided by ultrasound. The tissue samples obtained can help determine the nature of the lesion, differentiate benign from malignant growths, and guide subsequent management strategies. Lymph nodes are often targets of ultrasound-guided biopsies in patients with suspected lymphoma or metastatic malignancies. Ultrasound guidance enables accurate targeting and sampling of suspicious lymph nodes, aiding in the diagnosis, staging, and treatment planning for these patients. The procedure involves using a fine needle aspiration, FNA, technique to obtain tissue samples from the lymph node. The obtained samples are sent for cytological examination to evaluate for the presence of malignant cells. Thyroid nodules are commonly evaluated using ultrasound-guided fine needle aspiration, FNA, biopsy. This minimally invasive procedure allows for accurate sampling of thyroid nodules, aiding in the diagnosis of benign or malignant thyroid lesions. During the procedure, a small gauge needle is carefully directed into the thyroid nodule using continuous real-time ultrasound imaging. The aspirated material is then sent for cytological evaluation, providing important information for subsequent management. Besides breast, liver, lymph nodes, and thyroid, ultrasound-guided biopsies can also be performed for evaluating lesions in the prostate, kidney, lung, and musculoskeletal system. Each of these procedures follows similar principles, with ultrasound guidance ensuring accurate needle placement and sampling of the target lesion. The choice of needle type and technique may vary depending on the location and specific requirements of the biopsy. Complications associated with ultrasound-guided biopsies are generally rare but can include minor bleeding, infection, vasovagal reactions, and organ injury. The risk of complications can be minimized by following proper sterile technique, using appropriate needle sizes, and meticulous monitoring during and after the procedure. The benefits of accurate diagnosis far outweigh the risks associated with these procedures. Real-time ultrasound guidance has greatly improved the diagnostic yield and reduced the need for more invasive surgical procedures. The ability to accurately target lesions located deep within the body has revolutionized the field of interventional radiology and significantly impacted patient management. Ultrasound-guided biopsies have become an indispensable tool in the diagnosis and treatment of various conditions. Ultrasound-guided biopsies require expertise in image interpretation, procedural skills, and a comprehensive understanding of anatomical structures. Radiologists and other healthcare professionals interested in performing these procedures should undergo adequate training and maintain ongoing competency. Continuous quality assurance programs should also be in place to ensure optimal patient care and outcomes. In addition to biopsies, ultrasound guidance is also utilized for aspirations of fluid-filled structures, such as cysts and abscesses. Ultrasound-guided aspirations enable accurate location and drainage of these collections. The procedure involves inserting a needle into the fluid collection under continuous ultrasound visualization, facilitating safe and effective evacuation of the contents. Ultrasound-guided aspirations are commonly performed for various indications, including draining fluid collections in the abdomen, pelvis, breast, thyroid, and joints, among others. The real-time imaging provided by ultrasound enables precise needle placement and ensures successful aspiration. This technique has significantly improved patient outcomes by reducing the need for more invasive procedures and expediting the resolution of symptomatic fluid collections. In conclusion, ultrasound-guided biopsies and aspirations offer significant advantages in the accurate diagnosis and management of various diseases. The real-time imaging provided by ultrasound enables precise needle placement, enhances procedural accuracy, and reduces the risk of complications. These procedures have revolutionized the field of radiology and continue to play a crucial role in patient care. A comprehensive understanding of the principles and techniques involved in these procedures is essential for all healthcare professionals involved in diagnostic and interventional radiology.